your boy Jaja Medi again. Today we have another question, and this question is, what does high blood pressure do to your body? So if you have high blood pressure or you have any person with high blood pressure, stay tuned, find out. Don't forget to subscribe on this channel. I love you guys. Let's meet the other side. Yes, welcome to Jaja Medi channel. I'm so excited that you guys are here. Thank you. So today we are discussing what does high blood pressure do to your body. So first of all, high blood pressure can also be called hypertension. High blood pressure is a blood pressure that is above the normal. That is above 140 over 90 millimeters of mercury. So remember, high blood pressure changes throughout the day based on your activities and moods. There are several factors that affect high blood pressure. So remember, also high blood pressure is also called a silent killer. Why? Because the symptoms can develop later after the disease has gone beyond the moderate or it is already in a severe state. Stay tuned till the end of the video so that you can see or you can learn more about the effects of high blood pressure, the complications. Now let's look at how does high blood pressure affect the cardiovascular system. When we talk about cardiovascular system, we are talking about mostly the heart and the blood vessels. So how does blood pressure affect the arteries? One, when the blood pressure can affect the inner lining of the arteries, so that this can result into the collection of the fats that is passing through the blood to be collected on the walls of the arteries. This is called plaque. The collection of fats within the inner walls of the arteries, we call it a plaque. This results into narrowing of the narrowing of the arteries, and this again it causes even high blood pressure to increase more. Okay? The high blood pressure can also affect the elasticity of the arteries, of the walls of the arteries. How? Because the pressure is now much and the arteries can now no longer hold. So they can bulge at certain points, and these points are now weak. So when they break, we shall now have what you call blood clots or the internal bleeding into the blood vessels. Now let's look at how does it affect the heart. We all know that the heart is, or the function of the heart is to pump blood to the rest of the body parts through the blood vessels, especially the arteries. So because the heart is now working extra more, or it's working harder, this makes it to increase in size. We call it cardiomegaly, because the cardiac muscles, they are now working extra more. Okay? Assuming you also go to your gym, you do lift ups of some metals, your muscles are going to, your biceps are going to increase in size. That's the same way. Your heart is now, your cardiac muscles are now working extra. Okay? So they develop or they increase in size. We call it cardiomegaly. Also, the arteries that supply the heart, we call them the coronary arteries. So when they're also affected, we can end up having heart attacks. Reason, the heart is not getting enough because blood has oxygen and other nutrients that supply the heart. So if the coronary arteries are affected, we shall have the heart ending up into failure and heart attacks. Let's see, how does high blood pressure affect the brain? Remember, the brain depends on blood for oxygen, for nutrients. So if the blood vessels are narrowed or they are damaged, if the heart cannot pump enough blood to reach the brain, that means the brain will be deprived of oxygen and nutrients. So the brain can end up being also damaged. How? It can end up by having dementia. We can end up having stroke, because stroke also comes in the case as when the brain is not receiving enough oxygen. How does high blood pressure affect the kidneys? So when the blood vessels that supply the arteries that supply the kidneys are narrowed and also they are damaged, we shall end up having kidney failure, because remember, all these organs depend on oxygen and nutrients. So if they are not supplied very well with oxygen and nutrients, they end up failing. Okay? But how does blood pressure affect the eyes? So when the small arteries that supply the eyes are damaged, we shall end up with someone having blue-eyed eyes, and when it is worse, we shall end up in blindness. The retina can also be damaged. We shall also have build-up of fluids in the chondrion. That's called chondriopathy. Okay, so let's look at also how does high blood pressure affect sexually. Okay, so the sexual organs also depend on oxygen, on blood. For example, for men, erection happens because there is enough supply of blood to that organ. So if there is insufficient supply of blood, that means when the arteries are narrow, there shall be erectile dysfunction. For ladies, there shall not be enough arousal, okay, because of insufficient supply of oxygen to that side. So guys, thank you for watching. Don't forget to subscribe and like and comment down there and tell